Hello, everyone. Today, I would like to reflect on our materials that we cover, and it covers several psychological disorders, eating disorder, somatic symptoms and related disorders, elimination disorders, sleep disorders. These conditions, while clinically distinct, share some common themes of emotional suffering, impairment in daily functioning, and the need for comprehensive treatment. The documentary Dying to Be Thin brought attention to severe impact of eating disorders such as anorexia, bulimia, binge eating disorders. These disorders are not simply about food or image. They often stem from a deeper need for control, a response to trauma, or intense emotional distress. The consequences can be life-threatening, leading to malnutrition, medical complications, and profound social isolation. According to the DSM-5-TR, these disorders involve disturbances in eating and behavior that significantly impairs health or psychosocial functioning. Treatment often includes nutritional rehabilitation, individual therapies such as cognitive behavioral therapy, also known as CBT, and in some cases, medication. Family-based therapy is especially effective for adolescents, where caregivers are actively involved in the recovery process. Next, we'll move on to somatic symptom and conversion disorders. The video Body Talk, stories of somatization along with the explanation of somatic symptom disorder and conversion disorder highlighted how emotional distress can manifest in physical ways. These are individuals whose symptoms, pain, paralysis, and seizures are real but not explained by medical causes. This disconnect often leads to years of unnecessary testing, stigma, and frustration. The DSM-5-TR describes somatic symptom disorder as involving excessive focus on physical symptoms that cause significant distress. Conversion disorder involves neurological symptoms like the loss of movement or sensation without neurological causes. The symptoms includes validation of the patient. The treatment includes validation of the patient's experience, psychoeducation, and often a combination of psychotherapy and physical rehabilitation. Establishing a strong therapeutic alliance is crucial to recovery. Next, we'll delve into elimination disorders. The lecture on elimination disorders, we learned about enuresis in inocapricis, typically diagnosed in children. These involve repeated urination or defecation in inappropriate places, while they can be voluntary or involuntary. While they may appear to be behavioral on the surface, they're often root in developmental disorders, stress, or even trauma. The DSM-5-TR requires that these symptoms occur beyond a certain developmental age, so below 5 you would not diagnose. And persistence for a defined period. Treatment focuses on behavioral interventions, supportive parenting, and in some cases, addressing underlying emotional or family-related stress. Importantly, harsh discipline worsens the condition. Children need reassurance, structure, and understanding. The final video focused on sleep disorders, and it reminds us how crucial sleep is for our overall health. Disorders such as insomnia, narcolepsy, and sleep apnea can be debilitating. Chronic sleep issues affect not only physical health, but also mood, concentration, and emotional regulation. Insomnia is one of the most common sleep disorders and involves difficulty falling or staying asleep. CBT for insomnia is considered the gold standard. Focusing on both sleep habits and unhelpful belief about sleep, while medications exist, they are short-term solutions and may come with side effects. Disorders like sleep apnea, which involve breathing interruptions, or narcolepsy, which includes excessive daytime sleepiness, and cataplexy, require more special interventions such as a CPAP machine or stimulants for insomnia. Parasomnias include sleepwalking and night terrors, especially in children, and they often improve with age and reassurance. So, my final thought is that across all of these disorders, a few key themes emerge. First, each disorder significantly affects a person's quality of life. Whether it's isolation of an eating disorder, the confusion of somatic symptoms, the embarrassment of elimination issues, or the exhaustion from poor sleep, these are not just clinical terms, but human experiences of distress. Second, treatment should be holistic, whether it's through psychotherapy, behavioral interventions, or medication, and even lifestyle changes. We must treat both symptoms and the person. Early recognition, empathy, and willingness to see beyond the surface is vital when treating anybody with a mental health disorder. Lastly, collaboration is key between providers, families, and clients themselves. When we listen without judgment and treat evidence-based care, recovery becomes not only possible but likely. Thank you all for listening.